This is the fourth module in the MAP project SADS training. In this module, we'll be discussing the anxiety component of the screening section. The anxiety screening module of the SADS contains a number of subsections. The specific ones that you will complete will depend upon which anxiety disorders you are validating in your context. Examples of possible modules include panic, agoraphobia, social anxiety, specific phobias, and generalized anxiety. In all settings, the generalized anxiety questions will be used, and potentially the other conditions as well. The first section is about panic attacks. Here you can see there are a number of associated symptoms that you can ask about. What you want to learn is whether or not an attack has occurred and what things happened during the attack. As we know clinically, everyone interprets something like a panic attack in a different way. We want to make sure that the specific episode that the adolescent experiences has some of these hallmark characteristics, such as the heart beating quickly, suddenly sweating, feeling trembling or shaking, shortness of breath or feeling like you can't breathe, feeling of being choked, chest pains, sudden nausea or abdominal distress, dizziness, lightheadedness, feeling heat or chills, numbness of the hands and feet, a feeling of depersonalization or derealization, feeling of losing control, and a fear of death. You want to make sure that you have a sense of these associated symptoms to appropriately score subthreshold versus threshold. In subthreshold, there are occasional unanticipated attacks and less than 4 of the associated symptoms. To meet threshold, the recurrent attacks need to have 4 or more of the associated symptoms. So it's very important that you identify at least 4 of these associated symptoms to score the panic attack at a threshold level. To go on to the panic disorder supplement, you just need a score of 3 on this one question. There's only one screening question for the panic attack module. Now we are on to the agoraphobia screening questions. Whereas panic only had one screening question, we see here that agoraphobia has 2 questions. A threshold level score on either of these 2 questions would lead to completing the full agoraphobia module in the complete anxiety subsection of the SADS. One of the questions assesses symptoms of agoraphobia, the other assesses distress or avoidance. For agoraphobia, you want at least one experience from 2 or more of the following 5 domains. A lot of math involved in the SADS, as you can see here. So the 5 domains are being outside the home or alone in another situation, standing in line or being in a crowd, being in closed spaces, open spaces, or using public transportation. Here, as you can see in the italicized text, there's a number of ways to ask about this process. Have you ever been really afraid of being in a crowded place or going outside in public? Were you bothered by standing in lines? Were you afraid to go to the mall, movie theaters, or other places? It's important when we think about the context of your setting to distinguish this fear from a legitimate fear that something bad might happen in that setting. If, for example, there are experiences of political violence, crime, community violence, things like that in these settings, and someone is afraid to go, that wouldn't count as an agoraphobic episode, which should be fear without some type of external stimuli. Now, with the agoraphobia question, the subthreshold level is that fear is just limited to one of those 5 scenarios, and that it's typically mild or transient. The threshold level at a 3 means that fear is present in 2 or more of those scenarios, out of proportion to the circumstances. And this goes back to the idea that if someone as an adolescent is at risk of getting robbed or some type of violence might happen there, then that would not be out of proportion. If, for example, speaking with young girls, this is a situation where there might be issues related to sexual harassment, that would then fear of going there is not out of proportion to the circumstances. The second question is a distress or avoidance question. This is the idea of going to that situation. Did it scare them? Did it make their stomach upset? Did you feel more scared or more afraid than any of your friends? Has that fear ever kept you from doing anything in that situation? Did you try to avoid that situation? And if someone was with you, were you able to engage in that situation? So for the subthreshold level for distress and avoidance, subthreshold refers to associated with only mild or transient symptoms of distress, minimal or inconsistent avoidance. So once in a while, I feel too scared to go there, but in general, I'm able to do that. Threshold means that the feared stimuli or situations associated with moderate to severe symptoms of distress, stimuli or situations consistently avoided or requires presence of companion or for support. So for example, not feeling comfortable standing in a line alone, and so you always avoid when there's a line unless there's somebody with you. Or the situation of not going to a mall or some type of public place unless someone is with you. Now, we have to think about COVID times, and depending on your context and the situation in that country, there may be more typical avoidance. So as with all of the questions, make sure you're scoring threshold in a way that would be out of proportion to other adolescents their age. Now we are on to separation anxiety disorder. Whereas panic only had one question and agoraphobia had two questions, there are multiple questions for the separation anxiety disorder screening module. The first question refers to fear of a calamitous event that will cause separation. Typically, this refers to separation from a caregiver, a family member, or some other close individual. So for example, you could use the italicized text here or some variant of it. Did you ever worry that something bad might happen to you when you would never see your parents again, like getting lost, kidnapped, killed, or getting into an accident? How much do you worry about this? As with the prior questions, think about the context in which you're working, and as the child, the adolescent describes their fear, is it out of proportion to what other adolescents might fear? In many of the situations where we all work, there are settings where these types of risks can be quite likely because of political violence, community violence, or other concerns. So make sure that the fear is out of proportion to what other adolescents would feel in that context. Now, when scoring this, a subthreshold level is occasional worries or worries more severely and more often than a typical child or adolescent his or her age. For threshold level 3, frequently worries in separation situations, persistent and excessive worry that an untoward event will lead to separation from a major attachment figure. So concerns that are out of proportion to other adolescents their age. The next question under separation anxiety disorder is fears of harm befalling an attachment figure. Has there ever been a time when you worried about something bad happening to your parents? Like what? Were you afraid of them being in an accident or getting killed? Were you afraid that they would leave you and not come back? How much did you worry about this? Again, I want to emphasize the absolute importance of always adjusting these things to context. Although you see the wording here about parents, for separation anxiety disorder, if someone is raised by a grandparent, an uncle, or an aunt, those could be the individuals that are the primary attachment figures. In child-headed households, where there's an older sibling that runs things, it could be an older brother or a sister that is the attachment figure. Therefore, it can be quite useful at the beginning of the separation anxiety disorder section to identify different attachment figures. Who are the main people that take care of you? Who supports you? Who are the people that you talk to when you are distressed or worried about something? So that you make sure you're asking these questions about the right person, which may not always be a biological parent. In the case of this question, fear of harms befalling attachment figure, level 2, threshold, is an occasional worry or worries more severely and more often than a typical child his or her age. And then threshold, frequently worries in separation situations, persistent and excessive worry about losing or about possible harm befalling major attachment figures. One of the things that this is bringing up is how important it is for you to know what, say, typical levels of worry are amongst adolescents in this setting and be able to ask questions about that. So for example, if something like, say, going to the market to buy groceries or buy food and vegetables is not something that most adolescents worry about, you could ask the adolescent, when your parent is out, or whoever it may be, is out, shopping in the market, is that something that you worry about something bad happening to them? Because you know the context and whether or not that is a typical worry or not. Another aspect of separation anxiety disorder is the reluctance to go to school. Was there ever a time when you had to be forced to go to school? Did you have worries about going to school? Tell me about those feelings. What were you afraid of? How had you been going to school? How often did you miss school, or did you leave school early? This, again, is important to consider most recently in terms of situations like COVID. If an adolescent had not been going in person to school for a prolonged period of time, and you're doing these assessment periods just when adolescents are beginning to go back physically to school, then make sure you take that into account in terms of some concerns or worries they may have that are new for them. Subthreshold for this question is frequently somewhat resistant about going to school, but usually can be persuaded to go. Missed no more than 1 day in 2 weeks. Think again about your setting. Is something like missing 1 day in 2 weeks something that's quite outstanding and concerning, or relatively normal for that context? Threshold protests intensely about going to school or sent home, or refuses to go at least 1 day per week. Persistent reluctance or refusal to go to school. Now, let's think about a moment the idea that this symptom is trying to get at school reluctance or refusal in the context of separation anxiety disorder, which is being away from an attachment figure. If you have a 15, 16-year-old adolescent who is leaving the home to go play with friends, but not willing to go to school, that clearly is not a sign of separation anxiety disorder, because they're able to leave the house and go socialize. So make sure when you are tapping into school reluctance and refusal that it's in the context of not separating from an attachment figure. See here this important note: only count if school avoided in order to stay with attachment figure. So ditching school, skipping school, playing hooky, whatever idiom is used in your setting would not count. It's refusing to go to school to stay with one's attachment figure. Another screening question for separation anxiety disorder is fears sleeping away from home or sleeping alone. Has there ever been a time after the age of 4 when you were afraid to sleep alone? Did you get scary feelings if you had to sleep away from home without your parents being with you? Do you move to your parents' bed in the middle of the night, or do you need your parents to sleep in your bedroom? Do you avoid sleepovers? This, again, is something that needs to be thought about using your clinical expertise and the context in terms of what's a reasonable level of behavior and distress that you would expect. In many settings, a child over the age of 4 may still sleep with their parents, and it may be a customary experience. So make sure you are adjusting that. You may have children over the age of 4 who still wake up in the middle of the night and go sleep with their parents. That is not necessarily a sign of separation anxiety disorder, and something like sleepovers may or may not be a typical cultural practice. So make sure that you are adjusting this question for something to tap into what would be an unusual experience in some way for other adolescents in your setting. Subthreshold, occasionally fearful, fears of sleeping away or alone, more severe and more frequently than a typical child his or her age. Again, the reference is another adolescent in that setting to make the determination. And then threshold, frequently fearful, some avoidance of sleeping alone or away from home, persistent refusal to go to sleep without being near a major attachment figure, or sleep away from home. But make sure this is out of proportion to what one would expect for other adolescents in your setting. The final question in the separation anxiety disorder screening module is fears being alone at home. Was there ever a time at the age of 4, after the age of 4, when you used to follow your mother wherever she went? Did you get upset if she was not in the same room with you? Did you cling to your mother? Did you check up on your mother a lot? Did you always know where your mother was? How afraid were you? How often did this happen? This, as with all questions, need to be adapted to your context. So mother may not be the primary attachment figure. It could be someone else. And also, what are the typically expected levels of attachment following around being in the same room with someone? Also, if you have a house that only has one room, then this question is not very appropriate and needs to be modified. So think about settings in your context that may be typical, and those settings in your context where somebody would be getting distressed in some unusual way. Subthreshold, occasionally fearful, fears of being alone, more severe and more frequent than a typical child his or her age. Threshold, clings to mother, fearful, some avoidance of being alone, persistent and excessively fearful, or reluctance to be alone or without major attachment figures at home. So if we think about example before of a caregiver in the home leaving to go to a market, does the adolescent feel comfortable and safe at home while that caregiver is out of the house, or would they prefer to go with that individual, taking into account realistic fears that may be appropriate given the security or lack thereof in the setting? Okay, once you've asked all 5 of those questions, you can make a decision about whether or not to go on and complete the full separation anxiety disorder module. Now, as I've said above, there are a number of questions that may lead to a certain type of response that might not actually be pathological, but consistent with the setting. So be very careful, especially in the separation anxiety disorder module, that you aren't increasing the likelihood of a false negative. That is, they're kind of answering level 3 to these questions, but it's actually in keeping with what other adolescents would do in that setting. So just keep those things in mind. If, however, you do have concerns and at least one of these questions is scored a 3, you go on and complete the full module. We are now in social anxiety disorder. This also has a number of questions that you want to ask. The first is fear of social situations and failure to speak in specific social situations. Selective mutism is another symptom that might be associated with this. So for fear of social situations, are you a very shy person? Have you felt nervous, self-conscious, shy around people that you didn't know well? Issues of feeling shy speaking in front of others, eating in front of others, writing in front of others, using public bathrooms, performance situations, going to parties or social events. For adolescents, you want to think about what the typical behavior is in that age range, and then accordingly make a score here of whether or not that adolescent appears more afraid of social situations than others would in that setting. Please be sure that you keep gender in mind. There might be expectations in a certain cultural context that a girl should be more shy than a boy in certain types of context, or even related to ethnicity, race, and caste. Always context should be kept in mind when making a judgment of whether or not the symptoms are out of proportion to what other adolescents would feel in the same situation. For subthreshold, clearly self-conscious and uncomfortable in social performance situations, avoids only 1 or 2 activities that are not critical to the child's well-being, avoiding large parties where a child knows no one. If we think then about the threshold level, threshold is considerable self-consciousness that makes the child uncomfortable in several social settings. At least one activity is avoided. For example, repeatedly and persistently refusing to answer questions in class, avoiding gatherings where a child does not know anyone, a marked and persistent fear of social performance situation, fears acting in a way or showing anxiety symptoms that will be humiliating or embarrassing. Do not code as threshold if the child's only fear is giving oral presentations at school. So things that would provoke anxiety in most adolescents should not be scored as a form of threshold level disorder here. The second question is specifically about failure to speak in specific social situations. This is back to the idea of selective mutism. Do you ever feel like you couldn't talk in school, felt so shy that you couldn't just say anything? Are there certain situations that you just can't talk in? Now, one of the things to note about these questions for selective mutism is that the questions are about being unable to talk. You could be reluctant, you could be shy, you could speak slowly. So we're really trying to get at somebody entering into a situation and they just can't say anything at all. Subthreshold level 2 refers to child unable to speak in novel situations, including the start of the school year, but symptoms does not persist. Threshold, consistent failure to speak in social situations where expected to speak. So continually, even after it's become an accustomed situation, one refuses to verbally engage. This one, if you have a score of 3 on either of the questions, then you go on to the social anxiety disorder module of the full anxiety subscale. Now we are on specific phobias. So specific phobias is a substantial, difficult to control fear of a particular type of stimuli. Questions such as, are you very, very afraid of anything? Like really, really scared to death of spiders, insects, dogs, horses, heights, elevators, subway or the dark? What about crowds, being outside, being on a bridge, traveling in a bus, train, automobile? Were you afraid of any other things? So you want to find about a particular stimuli that is distressing to the adolescent. Subthreshold refers to fear of stimulus or situation more severe than a typical child his or her age. Again, keep things in context. And then threshold, marked and persistent fear that is excessive and unreasonable, cued by the presence or anticipation of a specific object or situation. Then there's the distress avoidance component, which is how scared did whatever that stimuli is make you? Did your stomach get upset? How long did it last? Are you more scared than your friends are? And additional questions. So this is to get at, does the specific phobia in some way cause impairment? Subthreshold is associated with only mild, transient symptoms of distress, minimal or inconsistent avoidance. Threshold is fear or stimulus or situation associated with moderate to severe symptoms of distress, feared stimuli or situation consistently avoided. So if there's fear, then that leads to avoidance. You are up to a level 3. So if either of these symptoms are scored a 3, you go on to the specific phobia complete module. Hey, now we are at generalized anxiety disorder, which I would argue is the most important submodule in terms of the tools that we will be validating. There are just 2 questions for this as well. The first, excessive worries. Are you a worry? Do you worry too much? Do you worry more than other kids? Have people said you worry too much? Has there been a time when you worried about things before they happen? Can you give me some examples? Note, if the only worries the child brings up relate to the attachment figure or a simple phobia, do not score here. Only rate positively if the child worries about multiple things. So if it's being separated from one's caregiver, go back to the separation anxiety disorder. If it's just a fear of spiders or dogs, go back to specific phobia to complete that. This is general overall worry. In many settings, adolescents will use the phrase thinking too much about something, and that would count here, just feeling like one is thinking about it over and over and over again. Subthreshold frequently worries somewhat excessively, at least 3 times per week, about anticipated events or current behavior. Threshold is most days of the week is excessively worried about at least 2 different life circumstances or anticipated events or current behavior. So what you're seeing jumping out in terms of making a threshold level score is that worry, as in the title of this order, is generalized. So not simply just a worry about school, but maybe a worry about one's grades and one's friends, or a worry about one's finances and a worry about one's health. But in generalized anxiety disorder, there is that pervasiveness of the anxiety that attaches on to many different domains of life, not just one. And again, this should be out of proportion to other adolescents in that context. If there are particular things that it would be normal for all adolescents to fear, especially related to things like violence, then that should be something that does not lead to a diagnosis of generalized anxiety disorder, but an appropriate response in a difficult situation. The second aspect of generalized anxiety disorder, and which is especially important for younger adolescents, is the somatic complaints question. As many of us know from our clinical work, it's very common that adolescents express anxiety through physical complaints, such as stomach aches, headaches, other aches and pains, as well as a worry about one's health overall and the fear of getting sick, the fear of becoming quite ill. With COVID, we again want to make sure that if the worry is specifically related to catching COVID, that might be a normal response to the situation and not something that would lead us to think that this child should be diagnosed with clinical generalized anxiety disorder. At subthreshold level, we want to talk about occasional worries, complaints, symptoms, complaints more severe and more often than experienced by a typical child his or her age. Threshold is frequent worries and complaints, worries about health preoccupy child and cause distress, so that worrying about one's health in some way cause impairment in any area of life. So pay very close attention to these two questions to then determine if you need to go on to the generalized anxiety module. Here is how you make your decision. If there is a score of 3 or more on either of the two previous items, then you go on and complete the full generalized anxiety disorder subsection of the anxiety module. In terms of generalized anxiety, this is the one where if you're not quite sure, if you can't decide between a 2 and a 3, it is better to select a 3 and then go on and do the full module to make that determination, because there's more questions there to make your decision. So I would say an especially important consideration for generalized anxiety is if you are on the fence about it, meaning maybe this is a 2, maybe this is 3, then more likely you should go for a 3 to go on and complete the full module. This is different than the advice I would give for something like separation anxiety disorder, which has a number of items that might not be culturally appropriate. So maybe there's possibly some 3s there, but they could be normal in a certain circumstance. I would not vote for kind of leaning towards a 3 in that situation, because it might be more just context related. But for generalized anxiety disorder, if you're not sure, make it a 3 and then go on to the subsection. You have now completed the subsections of anxiety and depressive disorder of the screening module. As I mentioned earlier, the specific components that you are doing may be modified in your context based on your PI's, your research lead's recommendations. We've gone through some of the modules. We didn't cover other ones, such as obsessive compulsive disorder. We didn't cover PTSD. We didn't cover psychosis. We didn't cover mania. There may be a decision based on the research questions in your setting to include some of those. There may also be a decision in your setting to drop some of the modules that we discussed. So just make sure that that is clearly understood and a plan is in place with your lead researcher. In the next module, we'll talk about some of the final scoring to make decisions about diagnoses.